Hello and welcome to Your Government in Action, a presentation of Bahamas Information Services. I'm Krista Williamson. Minister of Health and Wellness, Dr. the Honorable Michael Darville, highlighted the government's commitment to modernizing and improving the public health infrastructure. He noted major upgrades to clinics, hospitals, and facilities during his 2025-2026 National Budget communication in the House of Assembly on June 16, 2025.
I now turn my attention to healthcare infrastructure, where over $500 million have already been allocated in just 4 years in office, proving that our administration is making the largest investment in healthcare infrastructure in generations. Many clinics across New Providence and the Family Islands have been upgraded, not only physically, but we are completing the necessary digitization steps and providing labs and diagnostics on every island. In a matter of months, my brothers and sisters in Andros, Eleuthera, Bimini, Cat Island, San Salvador, Inagua, Long Island, Abaco, and by extension Exuma, will also have the ability to have lab and diagnostics done in their island. Through our digitization program funded by the IDB, patients will be able to receive their results for blood chemistries, full blood counts, cardiac enzymes, prostatic-specific antigens, cholesterol, colon rectal screening, X-ray, ultrasound, and breast screening. This is huge, Mr. Deputy, and we are not stopping there. In the past 4 months, you have witnessed the renovation and reopening of many clinics across the country, including the groundbreaking for the Coconut Grove Advanced Health Center, the new Mangrove Key Clinic, and the new state-of-the-art healthcare facility in Palmetto Point. Mr. Deputy, this is basically to really address what's going out on social media. They're saying we're breaking ground and we're not doing anything. This is the Coconut Grove Clinic that is presently coming out of the ground. And Halkitis was there. This is, you was there too, yes. Yeah, the MP and Halkitis was there.
Outgoing and incoming.
Yes. Yeah. Well, that's understandable. For now. This is the Mangrove Key Clinic coming out of the ground. This is the Palmetto Point Clinic. That's not just a drawing, it's coming out of the ground. During this budget cycle, we will finish renovating Inagua, Exuma, Long Island, Acklands, and break ground on a few smaller clinics across the country and complete our renovation of our 2 mini hospitals to ensure that we are able to provide extended services and urgent care services. Mr. Deputy, the Princess Margaret Hospital is the country's largest hospital, providing tertiary healthcare services for decades. This 70-year-old aging facility is more than a prominent hospital. It remains the training ground for many of our outstanding healthcare professionals and is home to the prestigious UWI Faculty of Medical Science and Clinical Research. At PMH, the long overdue expansion for the Accident Emergency Department is now 90% completed and scheduled to be fully operational by the end of July. Multiple unforeseen change orders delayed full occupancy, and I want to thank the Bahamian people for their patience and support during this difficult period. Additional funding was secured in the midterm budget by way of the $75 million loan facility from CIBC for hospital upgrades to complete phase 1 of the Freeport Health Campus and begin multi-story concrete structure for phase 2 to begin now to show the hospital in full-fledged and the state-of-the-art hospital fully operational before the end of our term in office. Mr. Deputy Speaker, I am pleased to report to this honorable House that the tender process for the long-awaited renovation for the Princess Margaret Hospital Legacy Ward, inclusive of the I Ward, the I Theatre, the PMH kitchen, the operating theatre floors, furnishing and medical equipment for the Accident Emergency Department in both Nassau and Freeport, is near completion, and the funding is in the $75 million. At the Rand Memorial Hospital, major renovations including the morgue facility, on-call quarters for doctors, the upgrade of medical infrastructure is 95% completed, and in a few months we anticipate full occupancy. The mold remediation exercise for the modular units to the east and west of the Rand Memorial Hospital facility is completed, and these units will go back in service in a few weeks. These units, when purchased, had some structural defects in the water supply, and when we initiated water to the units, some leakage took place within the walls, creating this problem with mold. Mr. Deputy Speaker, we are delivering on our promise to build a state-of-the-art Freeport Health Campus. Phase 1 of that project is expected to be completed by the end of the year, and this is a picture of the hospital coming out of the ground. We are getting ready for the EpiCore to pour the roof of this facility, and after that we'll begin to install the necessary windows and hopefully have phase 1A and 1B ready for turnkey by the end of this year, early next year. You invite Marcus Lee, right? Of course, he's always invited. In addition, the pre-qualifying bid documents for phase 2, inclusive of the multi-story tower and water and sewage treatment plan, will be released by the end of the summer. Following that, we will go out to tender, we will award a contract and start the construction of this multi-story reinforced concrete megastructure. On completion of this ambitious project, the residents of Grand Bahama will finally have a full hospital with oncology services, transforming healthcare on that island, and by extension, the northern services for years to come. Mr. Deputy, the expansion of mental health and geriatric services at the Sandilands Rehabilitation Center and the Department of Public Health is also a priority for our administration, and we intend to expand both inpatient and outpatient services across the country. In this year's budget, under Head 60, line item 228115, some $500,000 has been set aside to support integrated mental health services and community-based nursing projects for mentally ill patients who are displaying chronic symptoms, and provide teleconsultations for patients suffering from anxiety, depressive disorders. We have partnered with the Bahamas Psychological Association to assist with professional services, particularly in our family islands, now that some of the components of the new Mental Health Act is in force. A few months ago, 41 psychiatric nurses completed postgraduate training and are currently leading the charge in implementing many of the new mental health protocols that would prove to be a success and improve clinical outcomes. Meanwhile, funding is also set aside this year's budget for capital works to upgrade the Sandilands Rehabilitation Center, inclusive of additional bed space and equipment for the geriatric inpatient care.
Also, during his 2025-2026 National Budget Debate Communication in the House of Assembly on June 16, 2025, Minister of Health and Wellness, Dr. the Honorable Michael Darville, praised successful industrial agreement signings with key health unions in an effort to support healthcare workers and strengthen labor relations in the healthcare sector.
In the health arena, the government of the Bahamas has signed industrial agreements left behind by the former F&M administration for our nurses, the Public Service Union, the Bahamas Doctors Union, last month, addressing key concerns in compensation and working conditions. And I have learned that our Consultant Doctors Union industrial agreement will be completed soon, and it will be behind us. And I'm certain that the member who is responsible for public service will speak to that agreement and give clarity of where we are and how close we are to completing that. Additional contracts have been executed by way of the Inter-American Development Bank for the retrofitting and upgrade of the National Reference Lab and the procurement of new vehicles, both aimed at strengthening diagnostics and surveillance capability island by island. And we will break ground very soon, Prime Minister, for the Stevenson Clinic on Cat Island. The tender process for the Moores Island Clinic is near completion, and shortly after, Black Point and the Berry Islands Clinic will be signed and executed by way of IDB fundings.
With plans to further digitize the healthcare system in the Bahamas, Minister of Health and Wellness Dr. the Honorable Michael Darville, during his 2025-2026 National Budget Communication in the House of Assembly on June 16, 2025, emphasized greater efficiency and technology in the healthcare system as a part of his ministry's modernization drive.
Logistics remain a significant challenge in managing healthcare systems across the archipelago. Modern medicine, modern protocols require modern IT systems. In 2024, we launched the Information System for Health Bahamas initiative, the most ambitious digital platform in effort to modernize our healthcare system in decades. This initiative is streamlining patient care, making patient medical records more accessible, and ensuring that Bahamians are not left behind waiting because of outdated paper-based systems. Since October of last year, 42 school health nurses, have digitally documented 11,000 student health encounters. And the Chronic Non-Communicable Disease Unit have recorded over 7,000 interactions through our digital platforms. In 2024, the Ministry of Health and Wellness launched the Bahamas EMR Plus system, a locally developed electronic medical record system. This technology is currently being piloted at the Gambia and Adelaide clinics, where we are testing how it enhances patient care, reduces waiting times, and ensures that we are in a better position to manage medical records, both in the Department of Public Health and at the Princess Margaret Hospital and the Rand Memorial Hospital. Feedback from both clinics have been overwhelmingly positive. Patients are now able to pay for services using credit cards and debit cards, making transactions faster and more convenient. We are launching a new digital platform for e-prescriptions, e-vaccinations, online patient portals, allowing Bahamians to book appointments, receive test results, and manage their health care from anywhere in the country. I am pleased to report that these innovative digital platforms will be launched in our public clinics before the end of this year. This initiative is also by way of IDB funding, and once implemented will improve efficiency, reduce waiting times, improve confidentiality, improve healthcare integration, and improve clinical outcomes.
More of Your Government in Action when we return. Welcome back. Officials at the Ministry of Social Services, Information and Broadcasting celebrated the completion of the first phase of the expansion and renovation of the Department of Social Services headquarters located in the Sunshine Plaza on Blue Hill Road. A commissioning ceremony was held at the Sunshine Plaza location on June 20th, 2025. Our Matt Mora has more.
Minister Davis told employees that while they should be proud of the aesthetics of their new surroundings, the level of service clients receive when they step through its doors is what they will be judged on.
This renovated building is beautiful. It's modern. It's accessible. But what will define it, what will truly define it, is how people feel when they walk through those doors. Do they feel seen? Are they heard? And do we help them? We're not in this for titles. We're not here to clock in and clock out. We're here to serve. Every Bahamian who walks through these doors deserves to feel seen, deserves to feel heard, and to be treated with dignity, no matter their story, no matter their circumstance. I didn't come here to admire a building. I could care less about the paint on the walls or the size of the conference room. What I care about, I will always care about, is how we treat people who come in.
The Prime Minister shared his administration's vision for a Bahamas going forward.
We are building a Bahamas where no one is left behind, where the vulnerable are not just protected, but prioritized. That's the country I believe in. That's the government I lead. That's the legacy I want to leave behind. You see, when I think about what it means to lead this country, it comes down to one thing: how we treat people, especially those who can't give us anything in return.
Mr. Davis said no Bahamian should ever feel ashamed to ask for help.
I wasn't born into privilege, or as my grandfather say, I had no silver spoon in my mouth. I know what it means to struggle. I've seen what poverty can do to a family. I've watched people fight hard to survive in a system that sometimes makes them feel small or forgotten. So when I say this, I say it from experience. No Bahamian should ever feel ashamed to ask for help. It is the mandate of my government, our solemn duty, to help those who need it most, to go the extra mile, to open every door, to exhaust every resource. If it means cutting red tape, then let us cut it. If it means finding one more dollar, then let's find it. I would rather our government do too much for someone in need than to be remembered for doing too little.
Minister of Social Services, Information and Broadcasting, the Honorable Miles LaRota, also addressed the gathering. He said the expanded headquarters will better position the department to fulfill its critical role of overseeing operations across the country while guaranteeing that it remains on course to fulfill its goals and objectives.
Therefore, it is important that we not only provide adequate staffing and resources, but we should also create an environment for productivity to flourish. As you are aware, the head office of the Department of Social Services has the responsibility of overseeing all of its operation and is tasked with establishing departmental objectives, making critical determinations, and guaranteeing that it remains on course to fulfill its goals. It is the central link between the department's senior management team, its external divisions and units, and the public.
Minister LaRota said he looks forward to the completion of the final two phases of construction with great anticipation, as the finished product is expected to create a state-of-the-art modern facility that both clients and employees can be proud of. A key feature of the expanded facility, Mr. LaRota said, is that it is located in the center of several communities, bringing expanded services right next door for those who may need them. For your government in action, I'm Matt Mora.
The government of the Bahamas has made significant moves in a bid to address various challenges facing the country's judicial system. The challenges and remedies were highlighted during the Conference of Caribbean Chief Justices and Heads of Judiciary held at the Bahamar Convention Center on June 18, 2025.
This conference is extremely important. Its contribution to the administration of justice throughout our region cannot be understated. Judicial systems we know throughout our region are experiencing many of the same challenges, and the Chief Justice spoke of some of those challenges that we, as small island countries throughout the region, are experiencing. And we must address these issues. Under our administration, we have been aggressive in our legislative agenda to try to assist with the challenges that the Chief Justice has mentioned. We amended the Magistrates Act to increase the financial thresholds of jurisdiction of a magistrate to hear certain matters and adjust the maximum penalties that could be awarded. The broadening of the jurisdiction of the Magistrates Court is intended to rebalance cases between the Supreme Court and the Magistrates Court to relieve the volume of minor disputes from the calendar of the Supreme Court. As mentioned by the Chief Justice, we passed the Court Services Act, which empowers the Judiciary of the Bahamas to operate autonomously from an administrative point of view and takes away the oversight and a lot of times the bureaucracy that occurred from the central government when it comes to the functions and good governance of the judiciary. It certainly, I think, provides for a more efficient administration and operation of the judiciary. We amended the Supreme Court Act to increase the maximum number of judges in the Supreme Court from 20 to 25. This is a significant amendment, increasing the capacity to conduct trials in the Supreme Court by 25%. We amended the Bail Act. The Chief Justice mentioned challenges with bail and people out on bail. We amended the Bail Act to require an accused who is granted bail to enter into a reconnaissance of bail with conditions to which the grant of bail is subject. The amendment also provides that the breach of any of the conditions contained in the reconnaissance of bail shall result in that bail being void. The legislation provides for 3 conditions mandated to be in the reconnaissance of bail. The accused person shall not commit an offense while on bail, shall not interfere with witnesses, and shall duly appear at the time and place of trial or of an adjourned hearing and not depart the court without leave. Any violation of those mandatory conditions results in bail being void. We passed Anti-Gang Act. Certainly we have an issue throughout the region with violent crimes. We passed the Anti-Gang Act, which makes provision for maintaining public safety and order by discouraging membership in gangs, suppressing and punishing participations of gang members in serious offenses and in gang-related activities. The act makes it unlawful to be a gang leader or a gang member and prescribes the evidence which is admissible to prove membership in a gang. That has always been a challenge. How do you prove membership in a gang? We legislate the foundational elements of how you now approve membership in that gang. We also passed the Trial by Judge Alone Miscellaneous Provisions Act, which grants the right of election to persons charged with indictable offenses in the Supreme Court to be tried by judge alone. The act provides that the accused persons on arraignment in the Supreme Court may waive their right to a jury trial and elect trial by jury alone, but only after they have either sought and received legal advice or waived their right to such advice. We have had an aggressive, tough-on-crime legislative agenda coupled with legislation to enhance the operations of the court systems of our country. That has been a mandate of the Prime Minister. But this is not the end of our legislative agenda when it comes to being tough on crime and when it comes to the administration of justice.
Aiming to highlight the critical role that law enforcement plays in national sustainability, the Department of Marine Resources of the Ministry of Agriculture and Marine Resources held a 3-day workshop on fisheries law enforcement. An opening ceremony for the 3-day workshop under the theme Enforce, Protect, Sustain was held at Super Club's Breezes on June 19, 2025.
What is happening here over the next few days is more than just a workshop. It is a reflection of our shared mission to secure the future of our marine resources. Resources that feed our families, power our economy, and shape our identity as a maritime nation. Firstly, let us begin with the enforcement aspect. In the Bahamas, we are the stewards of a marine area more than 20 times the size of our land mass. Protecting it, as I'm sure you all know, is no easy task. It requires a network of committed agencies, strategic partnerships, and most importantly, highly trained and dedicated officers. And I think I'm looking at a few of them here with us now. We are fortunate to work alongside a growing coalition of enforcement partners. Our collaboration with BAWIN, the Bahamas Wildlife Enforcement Network, has helped coordinate our environmental protection across agencies. Our engagement with WildAid has also strengthened our marine patrol strategy, enforcement protocols, and officer readiness through training and technical support. We also continue to deepen coordination directly between DMR, the Department of Marine Resources, the Royal Bahamas Defense Force, the Royal Bahamas Police Force, and Customs, and local government administrators. Because effective enforcement requires all of us rowing in the same direction. I'm supposed to be a little joke in there when I said rowing, because we're dealing with marine resources. Okay. But let me be clear. Partnership simplifies and amplifies, both at the same time, progress. But it is our officers that must deliver. No amount of equipment, policy, politicians, or partnerships can replace the need for well-trained, vigilant, and ethical officers. Those willing to go the extra mile, often in challenging conditions, to protect the integrity of our fisheries for all of our sakes. To each of you serving in an enforcement capacity, I thank you, and I reaffirm this ministry's full commitment to investing in your continued development and support. One of our most urgent reasons for strong enforcement is our fight against illegal, unreported, and unregulated fishing, otherwise known as IUU. IUU fishing undermines the sustainability goals, threatens the livelihoods of our fishers, and damages our reputation in international markets. Foreign poaching, illegal gear, illegal charters, and unlicensed harvesting of conchs and lobster are not just violations, they are direct attacks on our food security and economic sovereignty. The Bahamas is responding with determination, expanding surveillance, deploying technology, and working through regional platforms like CRFM and CARICOM to close enforcement gaps across borders. But to succeed, we need enforcement that is coordinated, professional, and relentlessly committed to rooting out illegal activity wherever it hides.
I'm Carissa Williamson, and this has been Your Government in Action, a proud presentation of Bahamas Information Services. Join us on Wednesday evenings, where we bring you highlights, coverage, and information as we continue to do what we do best, linking people and government.